And more than likely, you've already had an STI at some point, and it doesn't mean anything about you. But I would really challenge like those roots of the stigma and start with learning about it. Because as you learn more and surround yourself in sex positive community, I think that you'll realize it is a part of sex, and we do what we can to minimize the risk.
Welcome to the Open Bedroom Podcast. I'm your host, Jennifer Kalo. Welcome to conversations about open relationships, online dating, and creating relationship dynamics that truly align for you. Hey guys, welcome back to the Open Bedroom Podcast. I'm your host, Jennifer Ruskin, and today I have Jordan Danelle. She is a sex coach, pleasure advocate, travel enthusiast, beach bum, and most importantly, podcast host of Vaginas, Vulvas, and Vibrators podcast, which is pretty steamy and exciting and interesting. And we're definitely going to have the link below for y'all to go check that out. Jordan, just introduce yourself. Who are you? Oh, and our topic, which is going to be all about just STIs, the risk of STIs with sex. And we're going to just dive into that topic. So first, Jordan, tell us all about you. Who are you?
Yes, thank you for the wonderful intro. I am Jordan Danelle. I am a physician associate or a physician assistant. They just changed the name in the last couple of years by trade. And I work with women's health primarily, and love to talk about STIs. And so I'm really excited to come have this conversation and raise awareness about the likelihood that if you are having sex, you are probably going to have an STI at some point over the course of your sexual experiences.
I love that. Okay. So as a physician's assistant, are you the one like doing gynecological exams? Yes.
So I work in a variety of fields, primarily infertility, a little bit of urgent care, used to do some primary care. But yes, I am the one doing your pap smears, your pelvic exams, your STI screens, the diagnosis, the treatment, all of that. That's what I do.
Oh my gosh, I'm so excited to talk to you today because I haven't talked about STIs in at least a year. And when I did, I was still feeling very fresh and green from opening up our relationship and like all the things that come with that and regular testing. And I remember being like the overachiever patient to my little nurse practitioner lady. And I'm like, okay, I want to test regularly. Like, is every month too much? And she was just like, honey, you're a lot. And I was like, I'm in this open relationship and da 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 da. And she was just like, I don't think I've ever had any of my patients just be so open about their sexuality. So I'm curious, just tell us all of this. What do you see? How do you approach this conversation? What do you recommend? Let's just dive in.
Yeah, so testing can be really challenging, especially if your provider is not familiar with open relationships in particular, or non-monogamous relationships. And so a lot of times the medical education that we've received is very like by the CDC guidelines. Oh, you test for HIV once in your lifetime, right? If you are a heterosexual individual, that's what the CDC recommends. And so a lot of times our education is very different than what we actually use in real life. And so finding a sex positive provider or somebody who is informed about, okay, what does this look like when we are not having monogamous relationships?
How do we start there? So I live in Arkansas, which I think I was telling you, you're like, where is that? I'm in Arkansas, which is incredibly conservative, very like Republican, and we're taught that sex, you save it for marriage, you marry for life, which I haven't done. I've already been married twice and I'm on my third life partner. And, so I think a lot of the people surrounding me, and I would assume a lot of my own listeners probably have similar stories, is it's very religious and it's very secretive and quiet. So like our open community is smaller, obviously, because we're not in a large city. How does one find a practitioner that would be open to even like you feeling brave enough to say, I don't just sleep with my husband and it's consensual,
Yeah. I think there's a couple of parts to this. One is maybe having interview process with your providers and that you have a choice of who is serving your medical care. And so you may not hit it off with the first person that you go see, and it may not be a good vibe. You may just be like, I don't feel safe right away for whatever reason. And I would really listen to that intuition, or you could be kind of start bringing it up and be like, yeah, I'm in a non-monogamous relationship. What are you familiar with that? And maybe just ask them some questions to see what they're familiar with, what they know. And you could also be like, hey, this is what I am looking for. Is this something you're able to offer? So I think one of the biggest things that you run into with STI testing is when you ask for particular tests, sometimes there can be a lot of resistance. And having conversations, like if you go in to the first person and they're like, absolutely not, we're not doing that, there's no reason for you to do that, that's a really probably a good sign that this may not be a good fit for you. The other way is if you say that and they're like, yeah, okay, this is what I'm kind of thinking, when I order these tests, these are my concerns about ordering them. And, HSV in particular, we'll just kind of start with that because that has a lot of confusion around it. If I order this for you, it also doesn't mean that we know where it is, how long you've had it, all of these other facts. And so I think that that can also be helpful to give informed consent before ordering some of these tests, and having like mutual patient provider conversations. So it's trial and error. The other amazing thing for STIs in particular is there is so many at-home kits that you can now do and that you have access to. So maybe you do live in a small community. Maybe, your provider's partner is the teacher for your kids, and you maybe just don't want people in the community to know about your lifestyle. That can be a wonderful way to still get regular STI testing for whatever you want and not have to go through your local providers.
Okay, I'm going to go back because I have questions. So we all know it's expensive to see any medical person, right? So I'm trying to imagine, how does the conversation go? Like, can you call and say, I'd like to have a phone interview with a provider? Do you set up an appointment and say, I am here to interview a provider? Do you set up an appointment and go, I want to be tested for everything? And then before they do anything, you're like, hey, let's talk first. What does that look like?
Yeah. So most practices, although you would think that you could call and just set up an interview or set up a conversation, that's not how it's going to work most of the time, unless you're maybe talking functional medicine or outside of insurance-based medicine. When you're looking at traditional medicine, a lot of times it's going to be just schedule an initial consult. And you can just say, hey, I want to see if we're a good fit. Some offices may already just be like, oh, we don't offer that. We don't do that, which can tell you a lot about the office. The other thing you can just say is, hey, I want to do routine STI testing. Go in and see how the conversation goes. You may say at the end of it, like, I decided not to do any testing here because you aren't able to offer what I would like, or be like, oh, you know what, this feels really good, I would like to continue. And you have that choice.
That feels good, actually. I love to give my listeners like actual, here's the guide, like here's how to do this. And so this feels good. So this first step would be interview a provider, schedule an initial consult. Some things that I wrote down that you've already said are, you have your choice of provider. And I think for a lot of people, that feels like mind blowing, right? Like, I know people that are still seeing the same doctor or dentist that they saw when they were children. Like, they're like forever going to be like glued to this person. And you don't realize there's all these other experiences and all these other kinds of humans out there that might be a better fit. So I love the empowerment of that. One other thing that I thought of as you were talking is like being your own advocate. And so I know we're going to dig deeper into this, but when you're right, when you say, I want to do STI testing, I need an appointment, they're like, oh, here's your P cup. And you're like, no, 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 no. Like, I need the full panel. I want all the things. And I'm interested to see where this goes with like, you don't just swab the vagina. Like I didn't know any of this. So let's start with what's next. So you've had some consults, you've interviewed a few people, you found somebody that you love. Then what do you say? What do you do to get, and what do you need? Maybe we start with like, what do you need? And then how do you ask for that? Okay.
Yeah, I think starting with what do you need is a really good place to start because it's very complex. There is not necessarily one straightforward answer that fits every single relationship type or every individual. And so, basis, different types of tests that are offered. You have your gonorrhea, chlamydia, you have your HSV, you have your hepatitis B, syphilis, HIV, and then there's also something called marcoplasm. There's also trichomonas. And so there are kind of a large different number of STIs. Most commonly, when you go to your provider and you ask to be tested for everything, typically that's going to include gonorrhea, chlamydia, HIV, and syphilis. Maybe HIV and syphilis.
But not Hep B.
Generally not. No, that's
Okay.
another one of those that's usually, it's based on the type of sex that you're having potentially, but also based on if you've had it once in your lifetime, maybe you've been vaccinated, there's different things. And there's also hepatitis C too. So with that, the different types of tests there is blood tests and urine tests. And we can break down each of the STIs throughout our conversation today as well. But
I noticed you didn't mention HSV.
oh, I must have forgot that one. Yes, HSV is
Well,
in
I
there
was
too.
like, I think that's the forgotten one that unless you have symptoms, same for herpes, right? They're like, like HSV. They're like, I don't see, like unless you're having a problem, you don't have anything. And I worry a lot about HSV and like, am I carrying that? And am I like, is Scott passing that to other women? And like the shots that you can have, the immunization, what is it called?
HPV.
HPV, that's it, not HSV,
Yes.
HPV. I worry about like, I'm 40, I haven't had it. Should I get the vaccination? Does that actually protect my partners? Like, I want you to talk about all the
Mhm.
things. How can we
Ooh,
protect our partners and ourselves?
yeah. HPV is another really tricky one. So I think the most confusion with a lot of STIs are the ones that are viruses,
Okay.
because viruses are something that generally speaking kind of lives in the body.
Mhm.
And so with your infections like gonorrhea, chlamydia, you take antibiotics, that's treated. You move on.
Mhm.
With HSV, this is something that is lifelong. With HIV, it is something that is lifelong. With HPV, that is one where your body, 90% of the cases, will heal itself of the virus within 2 years. And so a lot of times that one is self limiting and it kind of goes its natural course. The vaccine, I think, is a really good choice for people who are in particularly non monogamous relationships. And you can get it up until the age of 45. Let me double check, but I believe it prevents against 9 different strands.
Mhm.
And of those strands, um, there is a handful that cause genital warts. And then there are the most common causes for cervical cancer. So this is the only vaccine that does cover you for cancer.
Amazing.
Only one that's available.
Amazing.
Now, that being said, it may not be for everybody to get a vaccine due to personal choices and all of those things, but that would definitely be recommended. However, with HPV, there's always the however, right? When it comes to STIs, it's like, but there's over 50 different strands of HPV. And so that vaccine is only protecting you
For 9.
against 9. So there is still the possibility of getting those other strands of HPV, but they're the more than likely not the high commonly seen ones for warts, and less common ones to develop cervical cancer.
And you mentioned urine tests and blood tests with HPV. You have to actually go up in your vagina, right? To do the
Yes.
swab.
Yep. So HPV is kind of an interesting one because it is done with your pap smears typically. It's not something that you get outside of a pap smear. It's typically done, depending on your age, every 3 to 5 years, depending on your previous abnormalities, maybe more often. But it is secondary testing that is done with your pap smear anytime it's abnormal or over the age of 30.
And that's really
General
tricky
guidelines.
because if you're in a non-monogamous relationship and you want to be chest tested, especially if you want to get vaccinated and you want to be sure before that you don't have it to get the vaccination, then insurance won't pay for it. So I've had, and they won't do a pap smear every year anymore either. So I've had to ask for the HPV swab and then pay out of pocket for it, which is super sucky.
Yeah.
Not that you can
And
do anything
most,
about it.
yeah, with HPV, like it's tricky because if you think about like plantar warts
Mhm.
or hands on or warts on the back of your hand, those are all caused by HPV. And it's just a different strand of the HPV virus.
Mm.
And so for most people, doing additional HPV testing is probably not something
Mhm.
that is necessary, I guess you could say. And most people, if you are sexually active, you are probably going to have at least one strand of HPV over the course of your lifetime. And since 90% of them are gone within 2 years, you probably wouldn't even pick it up on a pap smear if it's done every 5 years. So
Hmm. It's
it's
fascinating.
yeah, it's a very tricky one and it's hard.
It is. Can men have HPV?
They
Yes.
can,
So
and
I'm
there's no way to
curious.
test.
I know, right? I'm curious how you feel because this is a vaccine that doctors are starting to recommend for children, for teenagers. I'm curious how you feel about vaccinating, boys, especially since they're the ones
Yeah.
probably carrying it from woman to woman and onto themselves. How do you feel about vaccinating teens with HPV vaccinations?
So the vaccine is going to be most effective when given prior to any initial sexual experiences.
Okay.
And so that's why they recommend it so early, is because it's most effective if you've never been exposed to the virus. But say you're sexually active, you get the vaccine. Well, if you've already been exposed to it, it's not necessarily, and there's still flaws in vaccines, right? They're not 100% either. So it doesn't mean you will not get one of those strands, but you're significantly less likely.
Awesome. That's great advice. I have two teen boys, and we've really been struggling with because I want them to be mindful about sexual health, and I want to be mindful as their parent to ensure that they're keeping their women safe and they're keeping themselves safe as they get older and start to become sexually active. So I'm like, as a mom, I'm like, what should I do? And like, how should I help prepare them? Because they can't necessarily make this decision at like 15 years old. Like they
Yeah.
don't even understand any of this. Cool. I would love to talk more about HSV because I believe that's the number one or number two in terms of STIs. But is that considered an STD? Ooh.
Ooh, I love this question.
Okay.
So, STIs and STDs, the best language is STI for all of them
Okay.
because they are all infections. And generally, when treated or managed, they do not develop into a disease. And so the new terminology is really STI. Is it all the same thing? Yes. But disease can have a lot of stigma associated with it,
Mhm.
whereas infection is a little less stigma inducing language.
Okay. So
Now,
talk to us about HSV then.
HSV. I love to talk about HSV. I am actually on a nonprofit called Something Positive for Positive People, which is for people who have HSV and helping navigate the diagnosis and navigate understanding HSV. Because again, this is one where the stigma is more harmful than the actual infection.
Yes.
And so there are two types of HSV. You have HSV1 and HSV2. HSV1 is most commonly known as oral herpes or cold sores. However, you can get HSV1 and HSV2 orally and genitally. And so they go both places, but HSV1 is most commonly known as your oral herpes. Now, with this, testing can be pretty challenging. The CDC does not recommend doing testing unless, basically ever. They don't really recommend testing unless there is an active lesion. With testing, the most important thing to know as a consumer is that if it is positive, it doesn't tell you where it is located on the body. So if it comes up positive for HSV1, you do not know if you have oral herpes or if you have genital herpes. So testing, it doesn't tell you how long you've had it. So is this brand new? Has this been around a while? You don't know. And so sometimes the testing can be or add more confusion to the diagnosis as well. Also, the tests are not super accurate when you're looking at the blood test. When you're looking at the swab of an active lesion, that is going to be the most accurate way for testing. But the blood test is not super, super accurate. So again, adding to the confusion of the diagnosis.
How many people, like what percentage of our population has HPV or HSV? Like, could you give us, because I think that this helps normalize it, especially for people that have a new diagnosis and they feel a lot of shame. It's important to know that you're not alone.
So HPV, it's over 90%.
Wow.
And HSV, I believe, is about 80%, but let me double check that.
So just to be like to say the obvious thing is most adults are walking around with HPV or HSV. And I don't know about you, girl, but in our community of open relationship people, I have seen quite a bit of nastiness around, well, she has HSV, she has herpes, like, you know what I mean? Or him or whatever. And every time I see it, it makes me cringe. It makes my heart hurt because so many of us are walking around with stuff and it's shameful enough to have it in your body and know that you have it. It's even more shameful to then know that you have to tell your partners and be honest upfront about it. And you hope that potential partners can react with love and kindness and be educated. So maybe we can talk some about education here. It just is mind blowing to me, these numbers. Almost every fucking adult. So why do we act so weird about this? And maybe some of it's ignorance. So educate us.
Yeah. So I think there's a lot of parts to this. One of the big ones is you don't a lot of times associate an STI with kids. And when you think of cold sores, that's when a lot of people actually get herpes, is in their teen year or their childrenhood when, grandma kisses them, doesn't realize it. And that's how now they have herpes.
Wow.
And so this can come from it's a sexually transmitted infection. And so it can come from non-sexual encounters as well.
Chapstick. I had a friend in high school and I remember our principal, he was such an asshole. He grabbed her chapstick one day and put it on his lips. And a few weeks later, she started to have cold sores. This little teenage girl, and we knew that he had cold sores because we could see them. And I don't think she thought about it when he used it, or she didn't realize that he did, and we saw it. I am just like, bless their little hearts.
Yeah. And I'm not sure, they say sharing things. Well, okay, if you have an active outbreak, but if you share a cup of water with somebody or something, that's not going to spread herpes. There's so much misinformation about how it's spread. Your towels aren't going to spread it. The toilet seats aren't going to spread it.
Well, that's good to know.
So yeah, there's definitely a lot of misinformation about the spread of it.
On the internet.
Yes.
Yeah.
Yes.
Yeah.
But HSV, forgot where I was going to go with this about the spread. Totally lost my train of thought.
It's good to know because, I've had a lot of friends that have gotten it and they're not sure where, and then you look on the internet and it's like, you could get it from a toilet seat. You could get it from sitting in a strip club. You could get it if you like, shared a towel with your partner, blah, 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 blah. And so that's really interesting to know. It's really skin to skin contact with an active infection, which, I mean, if 80% of no, oh, you're like more
Well,
information. Here you go.
yeah. So yes and no, in that
Okay.
it is most likely spread when there is an active infection.
Okay.
However, it can be spread sometimes when there is not an active infection.
Shedding, right? Is that what it's called?
Yep, the
Okay.
viral load is shedding. And so um, this is where it just gets again so tricky in that like yes but maybe you just kind of get in this I don't want to say like this rabbit hole, but ultimately like you can transmit it if you have HSV, you can transmit it at any point. However, you are most likely to transmit it during an active outbreak. The other thing I was going to say about like why there's so much shame around talking about HSV and why nobody, when the majority of us probably have it and nobody's talking about it, a lot of people don't associate oral herpes or cold sores
Mm.
with herpes. And they think, well, I have the oral type. Well, it is still transmittable and probably how a lot of people have genital herpes. If you go down on somebody, you can still transmit that. And so I think it's just a lot of misinformation that has led to where we are today with our herpes education, really.
Jordan, does HSV1 oral, does it present the same generally as if you had HSV2? You're still
Yep.
getting the same outbreaks. Okay. I
Yep.
wasn't sure.
They look the exact same. You wouldn't know the difference unless you had the testing.
Okay. And
And
who the fuck cares anyway? Like,
yeah,
once you have it, it's like, do I have one? Do I have two? I mean, who really cares? It's there.
yeah.
So we
And
talked
you can
about,
have both.
and you can have both. Okay. So we talked about HPV, that your body naturally just gets rid of it within a couple years once you've had it within 2 years. We also talked about, is it Gardasil? Is that like the main?
Gardasil. Yep.
Okay. I'm trying to learn all of this, but we talked about, vaccinations being something that you can do. Can you, if you've had HPV before and you still want to get a vaccination, can you, or do you have to be negative to have it? Yes, you can.
Yes,
Okay.
you can. Yep.
Okay.
Because again, there are so many different strands of HPV that providing you probably haven't had all nine of the ones that it's covered for, or at least documented all nine of the ones that it's covered for. So more than likely you would have and still would recommend the vaccine.
Okay. And that can actually help prevent cancer from HPV, which is amazing. So it feels like HPV is not so scary, that it's kind of like the STIs where you have gonorrhea or chlamydia or whatever, and you just take a pill and then it's gone and yay, right? So like it feels easily beatable and not so traumatizing. While we're wrapping up HSV, can you talk about how can you, if you have it, how can you mitigate the risk of spreading to other people, mitigate the risk of outbreaks? And then if you're maybe with someone that has it, what are some things that maybe you could request of your partner or have a conversation about that could help, again, mitigate the risk of spread?
Yeah. So with HSV, the number one thing you can do is have conversations. When ask somebody who has HSV, when you feel safe to say, hey, I'm having an active outbreak, now is maybe not a good time to be intimate in that way, but this way may look really good for me or feel really good for me. So finding other ways to be intimate outside of sex where you have that potential spread. And again, if it's oral, then no kissing, right? But communication is going to be the number one thing. The other thing that we can do to help reduce transmission is barrier methods. However, they do not eliminate your risk because they only cover the area, they don't cover all of the skin. So the area that is not covered is still at risk for contracting an STI for our sexually transmitted infections. And so With HSV, if it's on your labia, depending on what type of barrier method, but if we're thinking about an external male condom, that's not going to cover that area and would be potentially transmittable. And so, with barrier methods, there is also, you can do antiviral medication as another way to help reduce your risk of transmission. So there's a lot of controversy over that, I think, and that it works really, really good for some people, and it does not work really good for everybody. And so some people might have some side effects from the medication. Other people may feel like they're having more often outbreaks from the medication. Some people may use it all of the time. Some people may use it before they choose to be sexually active. So everybody's a little bit different on how they use those. Some people don't use antiviral medication at all. I am one of those. I felt like I was having more breakouts. I don't know if it was just because I was more aware or what that was, but I choose not to use antivirals. And so those are kind of like the three big things. Things to look out for would be noticing your signs of an active outbreak. So, do you have nerve pain down your leg? Do you have kind of a weird sensation? Maybe you have discharge changes. If you have a vulva and vagina, maybe you notice some discharge changes, maybe even some like burning with urination. That can also be seen with HSV. And so starting to pay attention to like, what does an active outbreak look like for you, noticing those patterns so that you can recognize it early and be able to tell your partners so that you are active in different ways or choosing to not be sexually active.
Awesome. Very helpful. Okay. What should we move on to next? What was marcoplasm and trichomosis? I tried to write them down and I was like, I don't know how to spell any of this stuff. I don't even know what it is.
Yes. So marcoplasm is a new STI.
Okay.
This was recognized by the CDC in 2015 and generally is not going to be tested for unless you are having symptoms and everything else is negative. So the only way a lot of times to get testing for this one is through the online companies. Those seem to have a lot easier access. A lot of clinics that you physically go to just A, don't know what it is, B, don't know how to order the test, or C, don't know what test to use. Like there's a lot of barriers to it. There's been one clinic I've worked in that actually tests for that. So it's very hard to get testing for. And then trichomoniasis is a parasite that we can have, typically screened with pap smears. Usually a vaginal swab is how you would test for this one. Biggest change is going to be discharge changes.
Okay.
So more like a yellowy green discharge with that one.
Okay. And because that's a parasite, it's not a bacteria. How do you treat that?
You treat it with oral medication.
Oh, that's not terrible.
Yep. So think of like bacterial vaginosis. It's the same medication that you treat bacterial vaginosis with as well.
Which is super fun. I just recently went through that. I've never had like a bacteria infection in my vagina before. And I was like, oh, wow, this is intense. There's like all these oral meds and like suppository thingies that go up your vagina. And it's like 10 days. But man, when I was done, I was like, I have like a brand new vagina. Like everything's so clean and smells amazing and feels different. And I noticed, I know this is a tangent because it's not an STI, but I noticed I was having pain with intercourse and that's not normal for me. And I was like, Scott is normal sized, like he is not giant. And so I noticed he would have me in a particular like sex position. My kids are like right over there. In a particular sex position where like he'd be on top and he'd be like kind of like pounding into me and I would feel burning like he was tearing me. And I was like, maybe it's just the position. I kept telling myself and rationalizing that it must just be this position and he's just really getting at it and he was tearing like inside of me or something. And then it kept happening and I found out I was like gritting when he was doing it. Like I was like, this fucking hurts. And then I things started to smell a little weird and he was just like, something is off. I've been fighting I can't believe we're talking about this on a podcast. I feel a little bit embarrassed about this, but let's just do it. I mean, I can't be the only one. I have been fighting or like noticing over the last 6 to 9 months that my vaginas just smell different. And I'm like, well, I'm at the end of my implant. What is that called? My IUD, my Mirena. So maybe it's a hormonal change. And then I hit 40 in November and I'm like, maybe I'm perimenopausal and there's more hormone changes and things are just different. And then we got to this point where I was like, it's weird. Something is weird. And then I'm had burning. And I was like, this is not normal. And so I'm just sure that with like one of our female partners, I just got something, that passed around, yeah. So it wasn't terrible to deal with it. It was just, I never had, and now I have, and now I can spot, I'll be able to be like, okay, I've done this before. Like, I know what to do.
Yeah.
Yeah.
Do you know what, if this is too personal, you can say no, but do you know what you tested positive for?
I couldn't even tell you the medical name, I'm sure, but it was just like bacterial vaginosis.
Yeah. Okay.
Is
That's
that
the
right?
medical name.
Okay.
Yeah. Yeah. Well, in bacterial vaginosis, the reason why that's why I was asking, because I was
Yeah.
going to go on a tangent about it.
Great.
But with bacterial vaginosis, that is not considered an STI.
Hmm.
However, there is a little bit of studies out there about can it be transmitted from one female or one vulva owner to another vulva owner, quite possibly.
Yeah.
And so there's more research probably that needs to be done that can happen with that, but generally is not considered an STI, and it's just when our pH gets off, which can be from our sexual activities. Sperm is a different pH as well, so
Yeah.
that can throw things off. If you sit in a swimsuit too long, if it's a moist environment, yoga pants too long, things like that can all impact the pH of our vulvas. They're very sensitive. And then you get infections.
I love that we're talking about this because I want to normalize it. Like I hear, and I'm sure this is true, the vagina is a self-cleaning oven. Like you don't need to do anything. It's perfect. But especially when you and your partner are open and there's other vaginas or penises and then there are vaginas and penises that they're dealing with, like there's a lot of things. And I've noticed, now we're getting into the sex stuff. I've noticed when God, I hope my kids can't hear me. I've noticed when we have a new partner that, and we only date women. So just so if anyone's curious, like what kind of partner is she talking about? It's always women. There's like this getting used to period that my body has. So I should also say that we don't use condoms. So we have everyone test before. So they're not going to be testing for bacterial vaginosis. They're not going to be testing for a lot of these, whatever the marcoplasm and the trichomensosi, however you say that, like which eventually brings us to the conversation of if you're going to have sex, you're going to have to know that you're signing up for potentially the stuff. But so we don't use condoms. We are barrier free. And I like the fluids and I like the sharing of them. And so it's part of like our kink. It's part of our thing. And so I've just noticed, I guess I'm telling you all that. I can't believe I'm not turning red, but whatever. I've just noticed that like my own vagina takes a minute to like get used to the new fluids and the new makeup of the new person and sharing Scott, like he's in both of us. Okay, I'm just going to stop there. That was a lot of information.
Well, and that makes sense because each vaginal flora is going to be a little bit different. We are not all the same. We have a different amount of all of the different types of good bacteria and bad bacteria. And so when they mix, there is going to be a little bit of this like, okay, my body is maybe starting to grow a little bit more of this bacteria or a little bit less. And not all bacteria is bad. Bacteria is a normal part of the vaginal flora. And so as they kind of balance and come into normality within your own, I think that's very normal. Also, just going on a little tangent here, this is
Go
something I've
for it.
noticed for myself as well. Like when I have new sexual partners, A lot of times my body will also tell me who is maybe not a good partner for me. And that sometimes my vaginal flora, I develop BV very easily. And so if I do, a lot of times for me, it's a sign that like they're not somebody I should be with. Um, because my body is repulsing them for whatever reason, which on a spiritual level, you can decide what that means for you, but that's how it feels for me. But also like different there is always just like this little bit of time where it's getting used to a new partner.
Mhm. And we're talking about protected or barrier free. Like, do you experience this? This is a lot of TMI, and if you don't want to respond, this is fine. But I'm curious if a person who wears condom with a new male partner, I don't know this because I don't sleep with men outside of Scott, but like, does your body also have a new regulation thing, or does the condom remove that?
So I think everybody's going to be a little bit different in this. I feel like I have a huge sensitivity to condoms. And so the lubricant, like just all of it all combined makes me sensitive. And then I always am just kind of irritated. So I am kind of one of the girlies that probably is a more barrier-free individual.
Mhm.
Uh, and mostly I would say for me, I notice this more when I don't use condoms, especially if somebody ejaculates in me.
Right.
Now, if they don't ejaculate in me, usually it's less of an issue.
So that's good to know. So you have options,
Mhm.
ladies that are listening that have vaginas, that you have an option if you want them, and you want to deal with, having your body acclimate or not, or that being a sign that this isn't, man, that'd be really hard if it was like really good and you really liked them and your vagina was like, no. And you're like, but I really like them.
Sometimes you still do it.
Sometimes she's
It is what it is. Yeah.
enemy.
Well,
Enemy girls.
the other thing I was going to say too is like pH balanced lubricants can be really helpful as well.
Let's talk about that.
And yeah, so pH balanced lubricants are lubricants that are pH balanced, but as we know, the vaginal flora is very sensitive. And so I would make sure any lubricant that you're using is pH balanced. But that can also be really helpful if you start noticing like something seems a little bit off. Maybe grab your pH balanced lubricant just to help normalize the pH to maybe help mitigate something before it turns into a full blown bacterial vaginosis.
We're going to get into like a whole lube thing. I'm such a lube snob. So I want to know, like, do you have some brands that you like? I hate the sticky lubes. Like, I need it to be smooth or like super
Yeah.
moist. What do you
So
think?
I'll be honest with you. I'm a pure romance, just like me, girly. That has always been my favorite. Unflavored, obviously. I'm a sensitive girl. But that one I really, really like. And it re-wets with your natural secretions, which
Oh,
is something that's really different, I think, compared to a lot of other products. I have done an entire episode on lube and done kind of some information about the different ingredients, but pretty much everything that you buy in the store has byproducts of, oh, the yellow stuff or the green stuff that you put in your car. I forget what that's called.
it's a very technical, like scientific
Antifreeze.
name. Oh
Yeah.
God.
Like the byproduct of that, you've
Why
got
would
like
you put
things that have
antifreeze in your
pseudoestrogens,
yeah.
but a lot of the components that are in those over the counter lubricants have things that may not be the most body safe.
Okay.
The warming ones, I would probably stay away from. Anything that has like sugar products in there, probably stay away from. Don't use them for entrance. The ones that are flavored, the ones that have sugar in them, great for like play on your body. But when it comes to insertion, you are asking for an infection. The other thing, lubricant wise, a lot of providers will say olive oil or coconut oil. I would stay away from those as well. Just because they are food safe to be eaten does not mean they are vagina safe. And a lot of those are actually going to, because of the thickness of the oil, it's going to trap bacteria. And potentially actually lead to an infection as well. So be very, very careful when choosing a lubricant.
That is really good to know. I am going to circle back and make sure that we plug in your lube episode below so that you guys can hear more about this. I have said for a long time, I'm a huge coconut oil fan. We have it. We get like the big organic tubs at Sam's, and then I like break them down into smaller ones. So like they're on his side, they're on my side, they're upstairs, they're wherever we want them. And I haven't had any issues that I'm aware of. I don't know if that helped cause the BV or whatever, but that seems to be our favorite just because it melts really nicely and it doesn't ever get sticky. However, I'm totally open to trying some new stuff. So I will grab the Just Like Me from Pure Romance, the pH balance stuff. I want to try it. I'm excited.
Yeah, I'll send you a link that you can
Ooh,
use in show notes too.
thank you. Okay, awesome.
Yeah.
Okay, so we have talked about choosing a provider, doing some kind of an interview or initial consult so you can have a face-to-face and have a conversation. And if they act weird that you want to have STI testing done, you should swipe left and go find someone else. We've talked about what kinds of testing that we need. I want to ask about where do we need to have testing done, because that really makes your provider freaking the fuck out, especially if you're in a conservative place. They're like, you want to test where? Why? So let's talk about that.
Yes. Okay. So this, I think, is another really important thing to talk about. And all of this comes down to what type of sex are you having? And what is your risk based on the type of sex that you're having? And Dr. Evelyn Dacker has a book coming out that is really great resource for this, based on like determining your level of risk for how often you should be tested, which we can get into here in just a second as well.
Okay.
But
yeah,
you have oral testing. So you can get oral gonorrhea, chlamydia. You can also get, this is probably going to blow a lot of people's minds, HSV in the mouth. And so it can be inside your mouth. It can be in your throat, potentially. A lot of dentists will actually diagnose that. And I've seen one case of it. They told me the dentist told them they had it. I wouldn't know, like mouths are not my specialty by any means, but it is pretty common as well. And so do you have your throat? You have your vagina, if you have a vagina, or your urinary tract for women or people who have vaginas and vulvas and penises. And then you have rectal as well. And so really, like, what type of testing should you have comes down to what type of sex are you having? Are you having oral sex? You should probably have oral testing. If you're having only vaginal penetrative sex, no rectal sex, maybe you don't need to have any rectal testing. But if you are having anal sex, you are receiving anal sex, that would be another area to have testing done. You can transmit gonorrhea, chlamydia, HSV, syphilis, all of that there as well.
Would you have symptoms in your rectum and in your throat? Like, how would you know that you may have it?
You also, this is just a side note, just to blow people's minds, you can get gonorrhea and chlamydia of your eye too. I've seen it, but yes, like you can get, this is what just blows my mind.
Thing, or is it like you had it on your hand and then you're like,
I think every situation might be different, but maybe somebody accidentally came in their eye or
I've been on FetLife way too much in the last week. I'm like, they totally just got that all over her eyelashes.
So the thing with STIs that always blows my mind is that if you get strep throat, if you get COVID, nobody is panicking. Nobody. They're like, oh, well, stay home for 5 days, rest up, right? Take your antibiotics, you'll get better. When it comes to an STI, it's literally the same thing, but because of the stigma associated with how the infection could be spread is where it gets its name from, or like this bad rep, I guess you could say. So with your sore throat, that can be a common sign for STI of your throat if you have no other symptoms generally. But a sore throat would be one. A lot of these are not going to have symptoms. So about 80% of people will have zero symptoms of gonorrhea or chlamydia, even if it's genital. Especially if you're a vulva owner, you are more likely to be asymptomatic. Now, when it comes to the rectum, you may have some discharge, pain with bowel movements, kind of the similar general things that you would see, pain, discomfort, some weird things going on that would make you raise flags.
Okay. When? So how often should we get tested?
Yeah. Yep. So again, this is a very loaded question that depends on your types of sexual activity. So it depends on how many partners, are you adding new partners? How often are there new partners? Maybe you're serial monogamous, where it's certain individuals for a period of time. So some people choose to test before new relationships or new sexual experiences. Some people test generally about 3 months is what the standard is for non-monogamous relationships. But if you're having a lot of partners, you may want to do it more frequently than that. So it really just depends on what that looks like. If you're in, say, a polycule and there are, let's say, 5 individuals and nobody is having sex outside of the polycule, well, maybe you don't need as frequent testing, right? So it really just depends on what type of sex is being had. But I would say about 3 months is a really good number for most people.
Okay. I love the polycule thing. And that's like my dream is it's like a closed, maybe even larger, but like consistent polycule. So there's not constant concern. For us, our partner still has sex with other people. And so we probably should be more frequent. So I'm going to make a note that like every 3 months we should probably, and that's tricky because like Scott and I don't frequently add a new partner in. And when we do, we like for it to be a long-term partner. So we always test before that, but maybe that's enough. I don't really know, actually. It's tricky, is it not? And
It really is.
And it's expensive. So I want to ask you as well, because those listening will probably want to know, what's the most cost-effective way to do this? If you're going to do it every 3 months, is this like Amazon Prime, subscribe and save every 3 months, get 15%
Yeah.
off?
There is
Reminder.
I'll see if I can find it, but I believe there is one of the companies that does like a subscription box, a quarterly subscription box for STI testing, where it is at a discounted rate. So I think that is definitely probably the best option. Now, your insurance is generally going, if you have insurance, right? All of our insurance policies are so different, and it also varies like how much of labs do they cover. But a lot of the times, if you are having more frequent testing, insurance may cover it. But it also depends on what is being tested, and you can call your insurance company to figure that out. But I think the most cost-effective way, honestly, is probably online.
Yeah. The last time I went in, this was when I had the BV issue because I was like, what the fuck is going on? Like, I need you to test for all the things again, all of them. And I went to my gynecologist where I normally go to my RN, and they had them test everything, including HPV. We went ahead and did a swab anyway because I was like, something is wrong with my vagina. I don't know what it is. And because it was not a whole year, they charged me the office fee, which was, I don't know, $120 or something. And I have insurance. And then they charged me for all the labs. So I had like, or maybe it was a portion of the labs because they do a lot of discounting when the insurance won't pay for it, right? So it was like $178 for all the labs from the LabCorp company. And I was just like, this is so depressing. I feel like men can just be like, I need Viagra, or like, I need a quick test. And they're like, everything's covered. And for us, So freaking complicated, and I don't understand. So I love your idea of the quarterly subscription thing. I have no idea what that costs. If you have an idea, so
I
people
do,
can
yeah.
build it into their, their financial
Your
planning
budget.
or something, where like $400 a
Yeah.
year we're gonna spend,
Yeah. So I don't have insurance. I am a healthcare provider with no healthcare insurance because I am self-employed, but
Yeah.
um, I do the cash pay boxes. Generally, you're looking at about 130 to 180, depending on the brand.
Okay.
But usually that's going to be more expansive testing than what you traditionally get at a
That's great.
doctor's office. So the brand that I generally use is Everly Well, which I can drop that in the show notes for you as well.
Right.
And they do also have, I think those are the ones that do the quarterly box with a discount. Um, but that is one that I've been happy with, and they do a larger panel too.
Okay, so if you're like, okay, we're gonna test the three places, well, can you do that in your boxes? Do they give you like three
Ooh.
swabs, or do you need three kits, or how does that work?
You know, I have never had oral or rectal testing myself. Um, So that's a really great question. And no, it would not be in the one kit. You would probably have to get separate ones. Um, Interesting question that you
How's
asked that. I've
porn
never
stars
looked into that.
doing? Like I follow a few porn slash OnlyFan people on FetLife, and one in particular, oh my goodness, one in particular talks about regular testing. Instead, in fact, some of his posts will be like, "Hey, here's this super hot chick who's sucking my ginormous dick," and he's like, "I only play with people who test." And I don't know what their frequency is, but it's like every 2 weeks, all three
Every two
places,
weeks.
every 2 weeks. And I'm like, holy fuck, who is paying for all this testing? But how amazing to know that like all of your partners are being tested, and you can play freely. And
Yeah.
I'm sure we'll talk more about, the risk associated with that. But
Yeah. So I do know of like a place in LA that does that. Because I also know some porn stars and
mhm.
adult entertainers. And yeah, like it is more frequent. I believe pricing is like $200. Um,
So
but
it's
it's in
400 a month.
person.
Yeah, if you do it every
Yeah.
other week.
Yeah.
It
So yeah,
feels like a
but they're,
subscription thing, doesn't it? Where you're like, just come in, we'll test for whatever. There's a lab on site. Again, in Arkansas, that would never we have porn banned in Arkansas. You cannot get on Pornhub or any of the major
how do
ones.
you use FetLife then?
Well, FetLife is not banned for some reason. I'm not sure why. I don't know.
Interesting.
I can get on Fet, and I pay for Blessa for porn. And I can
Oh,
get that since there's the paywall. Yeah. So
I have
crazy.
not checked out Balesa, but the stuff that they post on Instagram, I'm like, yes, yes, yes. I love
Just
them.
last night, I was like drooling over one three-way situation.
Ooh.
Okay, so I feel like we've covered a lot. Where I want to bring this to is, reducing the shame and the stigma, and where do we go from here? Like, how do we show up in the world knowing if we're going to be a sexually active adult, which I would assume pretty much everybody is, and if you're not monogamous with your person, if you're dating, if you're seeing people, how do you this feels like a lot of questions. One would be, I guess, how do we normalize this? Two would be um, knowing the risks associated with sex, like just knowing your risks, knowing if you're going to be a sexually active adult, here's what could happen. You could have all these things that we just had, and here's how to not be freaked out about it.
So I think the first thing is educate yourself. So coming to something like this or listening to this podcast, doing different courses out there, different things to become educated is going to be a really great start. The other thing that I was going to say with that is be a responsible adult. So if you're having sex, get testing, be a responsible human, and do that to protect yourself and others. And I use the word protect not in a like bad way, but just the more information that you have, the more you can do with that information, right? And so empower yourself. Your health is very empowering, and take control and responsibility of it. I think those are kind of the biggest things.
Yeah, and I would add to that one, be a responsible, conscious adult. Like have the conscious communication with your potential partners. Let them choose, and sometimes you're going to get a no and sometimes you're going to get a okay. I've noticed on Field and even sometimes on Bumble, I got kicked off Tinder because I tried to do like a couples thing and then they were like, I'm been banned. But anyway, on the ones I can see, I'm seeing a lot of people go like, I have HSV too. Like, I just want to tell you before you swipe right, if that's a thing for you, sorry, but keep moving. Go ahead.
The other thing with that too is like just because somebody announces their status
Mhm.
doesn't give you any additional information about what are they doing to protect you or prevent transmission. Doesn't give you any information about, say, their last outbreak or anything. And so just being told there should still be conversations behind that. And I think, like you said, being a conscious human and having that communication is so important. It- Ultimately, when you share your status with somebody, there are three things that can happen. One is it's still a yes. Two is I don't know a lot, but I need to learn more information, and it's a maybe. And three is a no. You literally have 2/3 probability of it going in your favor. So communicate. Empower other people to make their own decisions about their healthcare. You don't know what's going on for them. So, some people who maybe have autoimmune conditions or are at increased risk, they may not want to have sex with people who have or are living with STIs because of their immune system. And so there's more to the picture than like, I don't want to say it's not about you, but like it's not about you. There's more to it, and empower people to make that choice.
What advice would you give a couple that's just decided to open up their relationship, but is confused and uneducated or terrified about getting an STI?
Mm. Well, I would really challenge you to start with like, okay, where is the fear coming from?
Mm.
So, what does it mean about me if I have an STI? And again, a lot of us probably have had an STI with HPV. Men can't test for it, and women probably aren't getting it on their testing if you're positive. So, more than likely, you've already had an STI at some point, and it doesn't mean anything about you. But I would really challenge like those roots of the stigma and start with learning about it. Because as you learn more and surround yourself in sex positive community, I think that you'll realize like, okay, it is a part of sex, and we do what we can to minimize the risk. And this is what happens in the event that we do get an STI. Also, learning about, PrEP is another really good thing to learn about. There's also a doxy pep. So those are some other things that we did not talk about here today, but there is some
What is
other.
this?
Yeah. So doxy pep is an antibiotic that you take after potential exposures to reduce your risk of gonorrhea, chlamydia, and syphilis. And so if you are, potentially at higher risk, talk with your provider about having this prescription on hand so that you can take it within 72 hours of potential exposure. And this is like, say, the condom falls off, or you did not get an STI information about your partner. Something happens, you didn't use a barrier, whatever that is. You have access to this antibiotic that can reduce your risk.
Amazing. Jordan, you've given us like I've literally taken 5 pages of notes. Like I can't wait to do the write-up for this podcast because there's so much information and so many good like links. We can circle back and do the book and all these, such great resources. You have a little mini course called The Sex Ed That You Wish You Had. Can you just give us a brief overview and I'll make sure and link that in case more people are like, I need more Jordan.
Yeah. So the sex ed you wish you had covers the basics of sex, sexual health, and pleasure. And this is a really great foundation if you are somebody that's maybe exploring or just kind of curious. It gives you that basic foundation to build and grow from.
I love that because most of us did not have sex ed classes, me included, Christian schoolgirl right here. And I know as an adult, when I started opening up my last marriage, I was like, I don't know anything. Like, I sort of know how to have sex like a 16-year-old, but I don't even know my own body. I didn't even know like the difference of vulva and vagina and all just ridiculous stuff that at 40 I probably should have known. So I love that you've created a course. Thank you for that.
Yeah, absolutely.
Thank you for coming on. This was so much fun.
Thank you for having me and letting me speak about one of my many passions.
This has been amazing. Okay, guys, make sure that you go down to the show notes below here, that you follow her on Instagram, that you go follow that podcast because it's incredible. Maybe even grab her course, and then all the extra stuff that we owe you, all the other links will be below as well. All right, Jordan, have an amazing day. Thank you for coming.
Thanks for having me.
Thank you for listening to the Open Bedroom Podcast. If you enjoyed today's episode, go ahead and give us a like and click subscribe below and stay up to date on all the new episodes that we release. If you have a topic that you'd really like more information on, leave us a comment below and we'll see what we can do. Feel free to share this podcast with all of your friends and especially your partners. This is a great way to open up some amazing conversations. We'll see you next week.